Today we're talking about race equity work at Planned Parenthood Keystone. And with us, Melissa Reed, President and CEO, and Sam Bobola, VP of Development. Why is racial justice important to Planned Parenthood? You provide health care. What's the correlation here?
Well, for a long time, what we have found is that racism is not only a crisis because of treating people's basic humanity as other or less than, but also because racism is, quite frankly, a public health crisis. We've seen that with the coronavirus pandemic, where people of color have been disproportionately impacted by coronavirus. And we also know that maternal mortality rates are 2 to 3 times higher with Black women than they are for white women, and infant mortality rates for Black children is much higher than white children. That's quite frankly unacceptable, and Planned Parenthood has a role to play in ending that type of systemic racism.
Healthcare has always been inaccessible for Black and Brown people, especially right now in a public health crisis like the coronavirus pandemic. It's impacting communities of color a lot more, and these communities have always been at risk for inaccessible health services. So the work and the services that Planned Parenthood provides requires us to actually be intersectional, because we serve a wide swath of the state that covers urban, suburban, and remote areas. White, Black, brown, yellow people live in all of these communities and have different health needs. So the work and the services that we provide necessitate that kind of intersectional approach.
Sure, we need to meet our patients where they are, absolutely. So, Melissa, what led to your decision to bring on Courageous to help PP Keystone with this issue?
Well, not only, as I mentioned earlier, knowing that Black women and people of color had disproportionately higher maternal mortality rates and infant mortality rates. But also when we looked at our own patient data, we found that people of color's rating of their patient experience was not as high as white folks who were coming to Planned Parenthood Keystone for sexual and reproductive health care. And I really wanted to explore why that was, and looked internally at the way we delivered care. And did our providers have racial bias in the way they treated patients? And we also looked at our staff experience scores and said, our staff of color having the best possible experience at Planned Parenthood Keystone, and how does that compare to our white staff members? And again, we saw, wait, there's a disparity here, and we need to do our own work internally.
Sure. And so one of the things that we've done is to recently create the Racial and Social Justice Committee. So what kind of activities are they leading us in? What's the goal of this? And talk a little bit about the committee.
Well, part of establishing that committee was really about digging deep into a lot of areas of Planned Parenthood Keystone structure, looking at our hiring, looking at our policies and procedures, looking at our board membership and our volunteers, and really going deeply into educating our staff and training our staff so that we could have difficult conversations, so that we could expand our understanding and be better at delivering on care and better at being a good employer for our employees.
The work that the Racial and Social Justice Committee does is really twofold, and it's a top-down kind of work that we're invested in. So not only is our board doing this kind of anti-racism and race equity work, but also our staff is doing the work too, because as Melissa mentioned, we have a lot of Black, Indigenous, people of color staff, and they have different needs than staff, non-BIPOC staff have. And it's important that as a nonprofit with a bold mission like Planned Parenthood, it really requires us to support our BIPOC employees like that. And so the work that they're doing is providing a space for our BIPOC staff to feel safe and empowered and to create a culture of inclusivity, and so that no person on our workforce feels like they aren't a part of the mission. It's a very inclusive environment. And I think that's incredibly important with all of the things that are going on right now. We're talking about the global pandemic, but this is really a time of like serious civil unrest. And so having a space for our BIPOC employees and for our non-BIPOC employees to have these difficult conversations really allows us as an organization to address some of the internal and external issues.
Now, one woman that I spoke to said, we are all facing the same storm, but we're not all in the same boat. And that really spoke to me because certainly I'm being impacted as the CEO of an essential healthcare provider in working to figure out how to keep my staff safe and working how to make sure our patients are safe and that we're delivering on the promise of care. But it may be a very different experience, perhaps, for a patient who comes to our doorstep who has lost their insurance coverage and their job recently, or for a staff member who has a family member who has been afflicted with coronavirus. And so this work is really about making sure that we are lifting all boats, that we are making that space for our staff to feel safe, for them to express their lived experience in an authentic way, and that it's valued and that it's respected.
Sure. And, a lot of organizations have done some sort of, diversity training or equity work. It usually amounts to like a seminar or like a single day training, right? We're doing a little bit more than that here. Can you talk about specifically how we're applying what we're learning to our hiring decisions, to evaluations of employees, and then also to the holidays that we take as well, too?
Sure. And I agree. A lot of race equity work and DEI work is very performative, I've found, at organizations and in corporate culture. What's different here is that it's ongoing. You can't end racism or implicit bias with a 1-hour seminar or podcast. This is an ongoing work that we are doing as an organization. We are constantly getting resource material for us to review, for us to discuss as a group. We are having newsletters sent out on a monthly basis to continue that education and to highlight areas of focus. We have, as you mentioned, the holidays. We have made Juneteenth a holiday beginning next fiscal year, which I'm excited to do. And we are also, with the hiring practices, looking at the questions that we're asking potential employees and, quite frankly, who's seated at the table, so that we make sure that our candidates are being treated equitably and that they see themselves represented at Planned Parenthood Keystone.
And I think it's really important that we emphasize that, yes, the work of anti-racism and race equity, you have to start somewhere. So it's great for a nonprofit or an organization to issue a public statement. I think we saw a lot of that right after the murder of George Floyd. But we need to push ourselves to dig deeper in that. And that's what Planned Parenthood Keystone is doing. We're getting into the very deep internal and reflective work of race equity and anti-racism. And so the Racial and Social Justice Committee is so important because it provides a space for all of our employees to come together and do that internal work. One of the things I'm pretty excited about is the committee has formed affinity groups. And that is, it's something so simple, but it's something so powerful, because if you're a BIPOC employee, you've likely never had a space to really appreciate who you fully are. And these affinity groups allow us to have the space to have difficult conversations, to talk about things that are going on, not just at what's happening in our community, but what's happening across America. Like I said, this is like a very fraught civil time for us. And it also is a space for us to learn from each other. So these affinity groups are a great platform for us to come together and really push ourselves to do more than just these annual diversity trainings and move forward.
Sure. Well, and some of the stuff that we do might look a little strange to people outside. And so I want to, kind of confront some of the misconceptions, a lot of people have been taught for most of their lives that the right way to overcome racism was to treat everyone fairly as if they were equals, or colorblindness, as it's often referred to. And a lot of people, cite the Martin Luther King Jr. quote about judging people by the content of their character and not the color of their skin. Why is that not sufficient in what we're doing, and why do we need to go beyond that?
I think, so for me, and I'm strictly going to speak as a woman of color, when someone says something like that to me, that they don't see color, that really erases what my identity is, because my identity is absolutely grounded being the daughter of immigrants and being a woman of color. I always proudly lead with I'm a woman of color, and so discussions about color blindness really just erase the personal and lived experiences of BIPOC individuals. So if you start from that level, you're just erasing experiences of people, and you can't really move forward if you're already starting at that deficit.
This is so true, Sam. And what I have seen and witnessed as a white woman is that when white friends or acquaintances or family members who say that, is because they're uncomfortable having the hard discussions. If we don't see race, then we don't have to talk about racism. If we don't see implicit bias, then we don't have to talk about the inequities that exist in our culture and in our systems. And it's really just a quick escape route. And that's not acceptable, because, you mentioned equality versus equity. Not everybody comes to the table with the same day, right? In the West Wing, they would say, what kind of day is it? So that child that shows up to school, what kind of day is it? Well, one child might have had a full breakfast, had their parents drive them to school, have new clothes on, and another child might have come to that school that morning without a breakfast and no parent to help them out, and with clothes that have been handed down. And then they're expected to go to the same classes and have the same outcomes. Well, it's the same with healthcare, right? We don't know what our patient's coming to that table with until we ask them. And the same treatment is not going to be right for the same person. And it's important that your healthcare provider, and what we strive to do at Planned Parenthood Keystone every day, is to meet that patient where they are, to acknowledge their lived experience, their identity, and what they're coming with that day.
Absolutely. So, why don't we look inward for a second here? There's been a lot of attention, especially recently, on Margaret Sanger, the person who founded our organization. She's been pretty heavily criticized for her involvement and pretty vocal support of the eugenics movement. And so I think it's important for us to acknowledge that. And can you say a few words about, kind of the legacy and how the organization has confronted that and moved forward?
Yes, Margaret Sanger did align herself with the eugenics movement, although she never did align herself with Black genocide, and her history and legacy has really been mangled. And yet it is important for Planned Parenthood to say that her position was wrong then, and it is wrong today. And it has never been Planned Parenthood's value to support eugenics, or to support anything, quite frankly, that doesn't give a person their own bodily autonomy and decisions over their healthcare decisions. So I think it is important to acknowledge that Margaret Sanger had some wrong-headed ideas, and yet she was also a maverick who really expanded access to birth control. And what people should know is that at Planned Parenthood today, we will absolutely stand with Black women and with any person who comes to us to let them decide what's best for them and their body and their healthcare future.
Absolutely. I'd like to dig in to a few more questions dealing with kind of this project here at PP Keystone within the current national context. Sam, you mentioned this a little bit ago, but as after the murder of George Floyd, there was a lot of public support for different organizations, especially Black Lives Matter, but general social justice focused organizations as well. But we've seen this a lot. There's kind of a long history of corporate involvement in social movements. Is that a good thing? It obviously gives some exposure and things like that, but there's some corrupting influences too as well. So can we kind of think about and reflect on if this is a something where the corporate support is necessarily a good thing, or is it sort of good and has some downsides?
Well, I certainly think it can be a mixed bag, but I think it's vital for corporations to take a stand. We live in a country where corporations have control a large percentage of the wealth in our nation and employ millions of people across our nation and insure them for their health care and so forth. So our corporate culture finally confronting their institutional racism, really looking at how their policies and practices impact their employees and how that resonates into community well-being, I think is a wonderful thing. And it's long overdue as far as I'm concerned.
I agree. I think it's important, while overdue, I think it's important that companies are publicly taking a stand against racism. I'm looking at what comes after that. After you make that statement, what else are you going to do? Are you hiring more Black and brown talent? Are you pushing yourself to empower your staff of color? And what supports are there to provide them with the things that they need to really thrive at your company? So like Melissa says, it's long overdue. The other thing that we really need to do, not just nonprofits, but also companies, is during this time, we need to uplift Black voices. And Planned Parenthood has stood with the Movement for Black Lives, The Color of Change, Sister Song, and other Black-led organizations because they've been doing this work for many, many years. And they have those lived experiences. And so it's really up to us to partner and to collaborate them to achieve true equity.
Sure. I mean, part of it that's important as well, too, is divesting from exploitative business practices, right? And I mean, what do we think real change would look like? Because, I mean, we talk a lot about representation, and representation is important. It absolutely is. But there's a lot of companies with diverse leadership that are still exploiting the Black working class. And so how do we go beyond these seminars and the reflection and create real change that's going to affect people both inside and outside of these companies and it's going to affect the nation on scale.
Well, I think one thing that Sam said is so important is by hiring more Black and brown people and especially promoting them to leadership positions. What we have found when you have a leadership that is led by women, by people of color, you have stronger stockholder returns, and you have a more just workplace. I also think that organizations like social media platforms need to do a better job at policing their content and making sure that racist content, white nationalist content is eliminated from those sites, because I do not think that hate speech is appropriate for those venues, and that those corporate leaders really have a responsibility to eliminate that kind of speech and hate on their sites.
And I think real change isn't something aspirational. I think there are things happening, or that things that have happened already that are part of the ongoing process of change, right? So Planned Parenthood Federation of America just announced Alexis Miguel Johnson as the permanent president and CEO. And she has decades of experience in the racial justice movement. And so that alone is setting Planned Parenthood on the path towards achieving true equity and helping reproductive freedom for all people. I also think it's interesting to see, how many women and women of color are rising to leadership positions. I think in 2018, it was the election year when the most amount of women and women of color ran. And it's so incredible to see that kind of representation. Because certainly when I was growing up, you didn't see that. It was really just not something that happened. So change is happening, but it leaves us feeling like, what else? It leaves you hungry for more and wanting to achieve more. And I think the responsibility is really a big responsibility to shoulder, but we can all do it together. And that's really what race equity work is about. It's like, we're in this together, and we can do it, and we can make it happen.
Right. And it's like the defund the police movement, which Planned Parenthood has supported and aligned themselves with. It's really about where are our resources spent, and shifting those resources to strengthen a community with better mental health resources, with more addiction treatment, with demilitarizing our police force and ending violence perpetrated by law enforcement. So there are real concrete steps that we can take as a community, as a nation, and as Planned Parenthood to increase the well-being and health and agency of everyone here.
Sure. We're running out of time, so we just got, I want to address one last question here before we go, and thank you so much for your time today. You talked about the need to be intersectional in how we approach this, and one of those points of intersection is one that America also doesn't like to talk about, which is class. And we like to pretend that class isn't one of those points of intersection in American society. How does class play into our concept of social justice here at PP Keystone, and especially with representation and things like this, and dealing with the same things that we do with racial justice? How does class play into all of this as well?
Well, I think the COVID-19 pandemic really illustrates this really perfectly, where essential workers on the front lines of healthcare, who were in the grocery stores as our checkout clerks, who were driving our buses so that we could get to work to staff hospitals, the janitorial services, cleaning those spaces so that we could receive health care. Those essential frontline workers are those who are paid the least, had the least amount of health care, and we're relying on them. They are essential, and yet we're denying them health care. I mean, there are more and more attacks going on to reduce access to birth control, to reduce access to abortion, and yet we're saying that these same people are essential to the well-being of our community, of our nation, for surviving this pandemic, and yet we're not giving them control over their own healthcare decisions. I mean, the hypocrisy is unbelievable. And these people who are in the lower income sectors, they have just this incredible instability already. And then when you put the unemployment on top of that, the economic volatility that we're going through, they more than ever need us to embrace them, to wrap our arms around them through policies, through investments, through healthcare opportunities, through more CARES funding, through Congress. I just worry about that community so much, and I'm always looking to how we can better deliver care to that community so that they have what they need to continue to be healthy.
At Planned Parenthood, a significant portion of our patients are low income. Mm-hmm. If we are not there filling in that gap, mm-hmm. where are they going to go? And so it's really necessary for us as a healthcare provider to do that intersectional approach to providing these services, because let's face it, if you're poor, if you're Black and brown, you're not getting the healthcare that you need. And that's unacceptable. I mean, that just, that sets you on a path where you're not going to be healthy, and it's leading to a host of behavioral, mental health issues. compounded by poverty, and it's just a mess. We just closed out our fiscal year, and we were looking at early data from FY20. So we served about 22,000 patients last year. 10,000 of them, or about half, were uninsured. That is just really sad, because if it weren't for Planned Parenthood, where else would these 10,000 individuals go? Mm-hmm. I just don't have the answer for that.
We really are an essential safety net for this community. And in many counties, there is no other place to go. And the current administration has worked really hard at trying to destabilize Planned Parenthood, defunding us through the loss of Title X and putting up additional barriers to access to care. And we've just fought back because we know our patients depend on us. Those 10,000 people last year, we have a promise to them to deliver on care no matter what, and our doors are going to be open for them.
Great. Well, thank you so much for your time. I hope we get the chance to do this again.
Thank you.